So welcome all to the 26th of the May meeting for the Technical Advisory Council of the Linux Foundation for Public Health. As ever, a reminder of the antitrust policy notice. So there are lots of people on the calls who technically work for competing organisations. So please do check the antitrust policy on the Linux Foundation website, and if in doubt, ask your company's legal eagles for advice. Similarly, as ever, we try and be kind in all these meetings. So we do have a Linux Foundation Public Health Code of Conduct. Please do familiarise yourself with it if you've not seen it before. And if you've got any worries, concerns, or reports of behaviour that you don't think are right, please do reach out to myself, to Jim and Claire, or email the Code of Conduct email address here. We'll help you out as much as we can. Technical Advisory Council. So I've put us all in here today. I remembered to add Lucy from GCCM as well. We have apologies from Robbie Jerome, and I think we're expecting Pete instead of Ed today. He messaged me about that earlier in the week too. Agenda today, I don't think we've got a presentation today, so unless somebody's going to tell me different, but I don't think we have. So I'll go through some notes. There's a few interesting events coming up, which I wanted to mention. And I've rejigged the project updates so that we start with existing projects, but then I've put placeholders in for the projects I know that are being proposed currently or about to be proposed, just so that people are aware of them before the proposal comes out. So it's not a horrible surprise for people. Oops. So my notes today, there's some interesting things going on. So in the UK, Open UK, which is an LFPH associate member, we've kicked off a healthcare data space. I'm going to be the chair, and Lisa Murphy from the National Health Service is co-chair as well. So we'll be spinning those up, probably first meeting sometime in June for the community. And we're looking to see what the community wants to achieve in the UK healthcare data space. So do we want to totally just hook off the back of what Gaia X are doing in healthcare, or do we want to do that plus some of our own things as well? So that's what we're kicking off. So that'll be coming up soon. Events, I've noticed there's a Cardea Interopathon. So I've dropped the Slack link and the web link in here as well. So the Slack link points to the place in the Slack channel where it was announced, and the web link goes to the homepage for the Interopathon. So please do check those out. In terms of helps, I've got two. One of these is please continue to comment on the Kubernetes for Healthcare concept doc. So this is not a formal proposal yet, it's just a concept. Please give feedback before myself and Jim work on the formal proposal. And also, dating back for a while ago, landscape page new layout. I've not seen any comments on that, so if anybody does, please do let me know on the feedback for that as well. I'm going to pause here for a moment. Does anybody else have any other interesting events or helps that they want to share? Nope. Going once, going twice, gone. Okay, brilliant. I guess I'll carry on. Existing project updates. So we mentioned the Interopathon. Anybody from Cardea have any other news? Not hearing anybody. Is that just my audio?
Hey, sorry. I've not heard anything. No other news.
Okay, no problem. Yeah, I figured the Interopathon would probably be taking up most of the effort at the moment. For myself in Herald, we've been working on a general purpose decentralized messaging protocol. And I'd like to report that I'm still very bad at naming things. So if anybody's got a better name, please do let me know. The idea behind this is it's not just for exchanging exposure tokens, but it can be used for other things as well. So a completely decentralized form of contact tracing, for digital contact tracing potentially, but also for other things like, you know, find my keys, find my equipment. There's a local announcement for public safety. So we'll be publishing details on that over the weekend, which is great. Any updates from COVID Green?
No, it's very much in maintenance mode at this stage. There's no active development happening.
Okay, great, thanks for that. And GCCN, Lucy, you got any updates? I noticed that this was on the last one. You were talking about a link. I've not seen the link. If it's there, please let me know.
There's I posted it in the
It's in the Slack, is it?
yeah, in the chat with the recording as well as the slides. That was
Perfect. I just missed it then. I'll copy that into this deck as well as the link in the previous one then.
okay.
Any other news you'd like to mention?
Not quite, but we're still trying to Adam to see when you will be available for a call, and I'm also
Yes.
probably add one to join so we can kind of move forward like with the codes kind of stuff. We're already moving forward based on some suggestions you gave us last time.
Great.
But still want to kind of formally kind of form this project. The code.
Yeah, no problem. I have quite a bit of time Monday, Tuesday, and Wednesday next week, so I'll drop you a note immediately after this meeting.
Okay, thank you very much.
Yeah, it's just been it's been one of those weeks this week, unfortunately, so sorry about that.
No problem. Understood. Thank you.
Okay, so that's the notes for existing projects. I'll then kind of rejig to the next page to mention new and potential projects, and these are the full list of other projects. So Jim's kindly pasted them in for me quickly before this meeting. He's not able to turn up today, but I noticed from Carol you messaged me and let me know that the proposal will be, I'll put announced rather than presented, because as Jim rightly said, it's already, the project has already been presented. It's just the proposal needs to be announced, right, in the next TAC meeting.
Sounds good, thank you.
Yeah, is that going okay, or do you need any help from anybody else on that?
No, that's fine. I think we know what we want the content to be. I just need to put it in the format that's needed for this. So should be good. Thank you.
Yeah, no problem. And Kubernetes for Healthcare, I thought I'd added that link. I shall change that link in a moment. So as I mentioned before, Kubernetes for Healthcare concept as well, including where that fits nicely into Linux for Healthcare, which is nice, is kind of out there. That's not a proposal. It's currently more of a request for comments, odd musings from my brain. So it will definitely need working. And then hopefully in 2 or 4 weeks time, probably 2 weeks time, I'll have a draft proposal as well. But I don't want to steal any of Carol's thunder for the next meeting, so we'll probably hold off for the meeting after that to announce it. Yeah, so if anyone's got any feedback on that document, please do let me know, because I want to make sure I can update it and give you an update on the progress for the next TAC as well. Other potential efforts. So these are project proposals that Jim is working with us on. Florida Maternal Mental Health Directory, also the Ukraine Refugee Open Source Electronic Healthcare Records, SDOH Navigator from the University of Rochester, and a patient engagement tool from Dell Medical School in the University of Texas, and the digital twin for patients at Miami as well. So hopefully we'll have a rapid release of proposals for LFPH for new projects during the summer. So hopefully people on their summer holidays can be writing lots of code and helping save lives, which would be amazing. But in all seriousness, it is really super gratifying to get lots of project proposals together. This is 7 that we've got in kind of 5 months. So I'm super pleased and proud about that. So thank you all for the efforts, and please do continue with the great engagement that you've been having as well. Are there any proposals that myself or Jim has missed off of this list? I don't think there are. No, okay, great. So yeah, new project ideas. I think we mentioned this before. So this is the list from previously. I don't suppose in the last few weeks anybody else has come up with kind of new ideas or anything else. Any potential new project ideas? No. Okay. Oh, I've got somebody talking to me in chat. Oh, perfect. That's the link. Great. Thanks, Lucy.
Adam, I have I think I want to share this. So these I just share like 2 links. So this is because GCC and we're looking for pilot partners, and one of the so we're speaking to the Indian efforts who are who did like the COVID credentials, and now they're looking more broadly at decentralized health. So this is the protocol I think they're they're working on. I don't think we can take them in, but I think there's probably some synergies. So we're looking at from the GCCM point of view. And yeah, I thought like probably like folks here would be interested in this and like decentralized health protocols.
That's
I think
great. Yeah.
more on the transaction level, kind of a decentralized, bring different kind of providers on the same platform and have discovery function and how individuals can interact with providers. So I've heard some good feedback from people I know on this one. So just want to share here.
Yeah, perfect. And that first link you put in chat, that was the video recording. Is that correct?
Yeah, the first one is the webinar.
Okay, I shall quickly put that in then, lest I forget. There we go. I've done it, so I can't possibly forget now. Great stuff. That's a great new project idea. I shall have a look at that as well. That sounds like it could be interesting for Harold as well with the protocol as well. Any other ideas for new projects or areas you think we should be focusing on or not focusing on? Nope. Okay, great. I don't think we've got a presentation lined up for today. I think we're kind of all in building proposal mode at the moment. So hopefully, on the next session in a couple of weeks' time, I'll put in. So Carol, do you want kind of 5 and 10 minutes in the next session to just briefly mention the proposal? I mean, how long time do you think you'll need?
Yeah, I would say maybe 10 to 15, just to remind everyone, what it is, but not go into a lot of detail.
Okay, not a problem. I shall note that down so that I remembered to program it in. So I'll make sure that you've got that time in the next meeting. So that'd be great.
Thanks.
Okay. And yeah, on this slide, actually, it's the future TAC presentation topics. We've mentioned these ones before. I don't think we've had presentations on these ideas unless it was on a call that I wasn't on. So is anybody who thinks would be good to do these presentations that I can kind of go talk to, or shall I remove them from the bi-weekly updates? I know somebody here. I'll talk to Jim about the middle one. Yeah, digital public goods. Can anybody remember what this item was about? I think this might have been a Jim mentioned item. But if not, if somebody can refresh my memory. Okay, I'll assume it's a Jim thing. I'll talk to Jim about that as well. I'll chase these ones up then. And if I can find people to talk on those subjects, I'll book them in for the next few meetings. But failing that, I'll remove them so they're not constantly in the slide deck as well. Is there any other topics people would love to have somebody come in and talk on? So, data standards in health services, or kind of a European contact tracing perspective, or anything like that that people would like to see that I can kind of go around and find people for? Okay, perfect. Well, if anything does occur to you, please let me know, because I'm keen to make sure these meetings are kind of super useful for everybody. We'll try and increase the amount of people on it and increase the use for the projects themselves. So if there is anything else, do let me know. I've got no other business today, so this is going to be the world's shortest LFPH TAC meeting. Does anybody else have any other business, anything they want to discuss whilst we've got the time? Because we've got like a full 40 minutes if needed.
I can just briefly mention something.
Great,
I had a couple of meetings with Jim about the public health data mesh, and Jim has put me in contact with some other people in the US who are in a similar space, I think. But we're still having discussions about that. We're still obviously seeing if we can get some good traction around that. So, but it's moving, but it's moving slowly. So there are other meetings pending. In the meantime, the underlying technology that Cisco was proposing could be part of the solution. Certainly wouldn't be all of it, which was a project in Cisco called BitBroker. The open sourcing of that is going ahead anyway, just under the Linux Foundation banner, maybe later, but for now, at least, it's being open sourced anyway. So that is progressing, and sometime in the coming month, it'll be put into the public domain and as a kind of an open source. The BitBroker itself is not necessarily just about sharing public health data. It's a generalized data broker technology. So just to let people know that that's happening, and then we can circle back to see if we can get traction in a public health domain with it.
Wonderful. Yeah, if you once that's announced, if you would like me to kind of let people know about it, please ping me the link and I'll put
absolutely.
It in
We very much welcome that. So at the time, we'll definitely get back in touch.
Great stuff. Thanks for that. Appreciate it. Anybody else for any other business? Nope. Okay. In that case, I shall briefly mention, the CARDEA Interopathon. So this is why you should be involved. It's a great webpage, so I suggest you all kind of go and read it. The link is in the presentation. It's also in the, I think it's the general channel on the LFPH Slack as well. But if anybody else hasn't got anything to mention, then I'll give you 40 minutes of your lives back, and you can go and actually have a break from Zooms, which will be fantastic for everybody, I'm sure. Okay, everybody, thanks for your time today.
Thanks, Adam.
Thanks, Adam. Bye.
Adam, thanks everyone.